Good morning, everybody. It is really exciting to be here at the Prince of Wales Hospital in Randwick to mark what we call the topping out ceremony. Here we are on the highest level of this 10-storey acute services building, which will be part of a broader $1.5 billion investment in this precinct. An extremely exciting project and demonstrating that even though we're going through a pandemic, that the New South Wales Government is committed to building all of our hospitals on time and on budget, a major program of work. So I want to thank everybody in health infrastructure in particular, our private sector partners and the Minister and his team for the great work they're doing in rolling out these hospitals. And before we talk about too much more detail about this specific key milestone, I will of course update you on the situation we have in New South Wales. As you all are aware, there was a case we spoke about yesterday of a guard acquiring the virus through the hotel quarantine system. We're relieved to say this morning that there aren't any further cases of community transmission. There were more than 8,000 people tested, notwithstanding it was over the weekend. We're pleased about those numbers and encourage anybody with the mildest of symptoms to come forward, but also encourage everybody to make sure they take on the health advice. And Dr. Chant will provide further details about some venues and other precautions we're taking to make sure we contain this most recent outbreak. I wasn't commenting yesterday on this, but I will say that whilst it's always concerning to have a case anywhere outside of overseas travellers, it is not surprising. We always know that it is a high risk, and it validates our position of making sure we vaccinate all of our hotel quarantine workers first and foremost to minimise the risk. We always know it's a risk of the virus seeping out. Pleasingly to date, there is no evidence of widespread transmission, but of course we know how dangerous the various types or strains of the virus can be, and health is doing everything they can to make sure we remain on top of it, and Dr. Chant will provide further details. I also wanted to provide an update on the vaccine rollout in New South Wales. Pleasingly, we reached our target. We've vaccinated just over 35,000 people with the Pfizer vaccine and nearly 2,500 people with the AstraZeneca vaccine. So in total, just over 37,500 people have been vaccinated in New South Wales in the first 3 weeks, which is a very pleasing result. And today, of course, we start the next 3 weeks, and we're aiming to have 80,000 jabs take place in New South Wales over the next 3 weeks. Of that, 35,000 will be the second of the first jab. So obviously with the Pfizer vaccine, you need to get the second jab 3 weeks later. So over the next 3 weeks, those people who receive the Pfizer vaccine will get their second jab. And there'll also be 45,000 people getting the vaccine for the first time. Out of that 45,000 getting it for the first time, 30,000 will be the AstraZeneca vaccine and the balance will be the Pfizer vaccine. Pleasingly today, we also start the rollout in our regional centres and hubs. We'd identified 99 hubs and spokes throughout rural and regional New South Wales that would be having access to the vaccine for our key health workers and other high-risk individuals that are working in and around our health system. And Minister Hazzard will provide further detail of what's available from today and then what's likely to occur in the next few weeks. I also wanted to extend a huge debt of gratitude to all of our special guests that are here today at the Prince of Wales Hospital, which Minister Hazzard will introduce, to really thank the partnerships that are here. This $1.5 billion precinct will provide global best practice, not only in providing health services directly, but also in research and development and a whole range of other supply chains which will provide health and education excellence in this part of our network, which is a really exciting place to be. So I'll ask Dr. Chant now to provide some further information on the health situation in relation to COVID. Minister Hazzard will provide further information about the precinct and also the regional rollout of the vaccine hubs, and will be available to take any questions after that. Thank you.
So New South Wales recorded that one locally acquired case in the 24 hours to 8 p.m. last night, and this was the person that we spoke about yesterday at the press conference, who works as a security guard at the Sydney quarantine hotels. There were 3 new cases were overseas acquired, and one overseas case reported last week was found to be an old infection following further investigations. Yesterday I spoke about our source investigations for this case and indicated that we had identified an infectious returned traveller that was in the Sofitel. Investigations have confirmed that this gentleman did work a shift on the same floor, floor 11 in the Sofitel, when this international return traveller was infectious prior to them being transported to the Sydney Health accommodation. And genomic sequencing indicates that they are a match, so it is the B1.1.7 with identical sequences to that as a security guard. We did review the CCTV footage, and can I just say that this gentleman was exemplary in his adherence to the procedures for mask wearing and other protections and precautions. So we haven't been able to find an exact source of the explanation for how this person became infected. So we are testing everyone who worked, co-workers who worked with this gentleman, to just check that there's not someone else who may have been an intermediary that transmitted to this gentleman. And also we're also going to be re-swabbing everyone on the floor of the floor 11 today. They would have been receiving their routine screening, but we're doing an additional test today to just check if there is anyone also that has this strain that we were not previously aware of. And we are extending the quarantine period for those people on floor 11 until the 23rd of March, which is 14 days after the 9th of March, when the infectious international traveller was removed from the floor 11 of the Sofitel. I'd like to also acknowledge and my gratitude to the staff that worked. This gentleman had worked an overnight shift on the night shift of the 12th, 13th of March, and we identified 167 staff who worked at the Mantra Central Hotel with the security guard. We've text messaged all of them, and we've spoken to the vast majority, 157 and 167, and a number of them have presented for testing. We will be following up for a matter of priority to ensure they're all tested, and we'll be assessing that, but those individuals will be advised to be in isolation for the full 14 days if they had close contact with the gentleman. But at the moment, those investigations are ongoing. In terms of the source investigation, we have also, as I indicated, identified those co-workers, and we are testing a number of the co-workers who worked at the Sofitel around the same time, again just to assure ourselves that there wasn't any further transmission amongst those workers. This gentleman did work at during the week as a building apartment in a building management role at the High Point Apartment Towers in Hurstville. And yesterday the building management worked with the public health unit to clean the common areas of the building and inform all residents and tenants of the potential risk. But I would want to reassure residents that this gentleman did not have any casual or close contact with any residents in that apartment complex. And what we're just chasing up is the gentleman's co-workers and organising for them to be a test, and any contractors that might have come onto the building site, the building complex, for to undertake building works. And the public health unit will be identifying those directly through the building management. In terms of the community exposure sites, as I just again stress, this gentleman was without symptoms, and so he was going about his business as would be expected, and they have been very compliant with everything we've requested of them. So in terms of this venues, we've identified the Beverly Hills Pancakes on the Rocks at 507 King George's Road. Anyone who was there between 10:45 and 12 p.m. on Saturday the 13th of March, if they visited that venue at that time, are designated as close contacts and should be immediately tested and isolate for 14 days regardless of the result. There's also a large number of casual venues where we're asking people to monitor for symptoms, and if they appear, immediately get tested and isolate until a negative result is received. And I'll just alert people to please go to our website to check through those, but I will just read through those quickly. The Bexley Aquatic Centre on Saturday the 13th of March from 9 to 9:30 a.m. Hudson's Coffee Shop, Hurstville Private Hospital on Monday the 8th of March from 8:30 to 9 a.m. Tuesday the 9th of March from 8:30 to 9 a.m. and Wednesday the 10th of March from 8:30 to 9 a.m. Coles at Hurstville Station on Wednesday the 10th of March from 8 to 9 p.m. Hudson's Coffee Shop, Hurstville Private Hospital, Thursday the 11th of March from 8:30 to 9. Again, the Hudson's Coffee Shop, Hurstville Private Hospital on Friday the 12th of March, 8:30 to 9. And then Day Jum Kum Korean Restaurant, Saturday the 13th of March from 12:15 to 12:20 a.m. And then the 7-Eleven at Capitol Square and George Street from Saturday the 13th of March, 12:20 to 12:25. We've also got the T line from Hurstville to Central on Friday the 12th of March, departing Hurstville at 6 p.m. and arriving at Central at 6:30 p.m. And the T line at Central to Hurstville on Friday the 12th of March, departing Central at 7 a.m. and arriving at Hurstville at 7:30 a.m.
Good morning all. I'd like to just start off by continuing the discussion about the rollout of the vaccine, and then I'll address what we're here for today in the topping out ceremony. So, as you've heard from the Premier and from Dr. Chant, the vaccine rollout is well underway, and of course many of you would be aware that we've already commenced 3 weeks ago the Pfizer vaccine through our 3 hubs at Royal Prince Alfred, obviously at Liverpool and Westmead, and that has been proceeding extremely well. As you heard, we've vaccinated more than 37,000 people just in its first 3 weeks, all frontline health staff and quarantine staff. But of course the AstraZeneca vaccine is also now available, and I just want to point out that in addition to those first 3 hubs that had Pfizer and the next 2 that were established last week at Newcastle and Wollongong, obviously as we reported last week, they were also established as hubs because of our ports that are located at Newcastle and Wollongong, staff there, the staff who would be looking after our ports and quarantine. So they're all part of the original Pfizer rollout, but we've also got AstraZeneca as of last week being rolled out at Hornsby and St George. Today we continue that through the Nepean Hospital and Justice Health as well. So we'll be looking to vaccinate not only the inmates in our correctional facilities but also the staff at the same time. 17th of March, so this Wednesday, we will be rolling out to Lismore and Coffs Harbour, and on the 22nd of March we'll be moving further into the regions at Dubbo Hospital, and there'll be satellites as well from Dubbo Hospital. We'll have Port Macquarie on the 24th of March, again on the 22nd of March, Bathurst, Orange, Cobar, Gilgandra, Galargambone. Gosford will be the 22nd of March, Wagga Wagga on the 22nd of March, Griffith on the 24th of March, Broken Hill also 22nd of March, and the other major is Tamworth on the 29th of March, and some of the smaller centres, Balranald, Wentworth, Wilcannia, Menindee and Whitecliffs, quite remote areas, somewhere between the 23rd and 29th of March. So we continue to do all we can here in New South Wales to support the rollout of the vaccine across the broader regional areas as well as the city areas, making sure that all of our health staff are vaccinated, but also, as you heard last week, the New South Wales Government has offered to assist with the federal government in the rollout of the AstraZeneca vaccine. Here we are on top of the world today at a major event, and that is the topping out of the new acute services building here at Prince of Wales. And I want to particularly acknowledge, and I can see him over there, David Gonski. Thank you, David, obviously the Chancellor of the University of New South Wales. Somewhere I hope Ian Jacobs is. Yes, there's Professor Ian Jacobs also. And I want to acknowledge also looks like, yes, Michael Still, the Chair of the Board, Professor Farnsworth, who I think is here somewhere, also representing up the back there, thank you. I want to acknowledge each of the Chief Executives, Elizabeth Crouch, who's from the Children's Hospital here at Randwick, and all of the other senior representatives who are here to take part in the topping out ceremony, which will occur shortly, but I just point out that we're going to take questions from the media here in regard to the COVID situation, and then we'll make some more comments. But I also just want to acknowledge the work of Health Infrastructure, Lend-Lease particularly, who are doing all this incredible work, the architects, and of course PwC as the project managers. But for the moment, there'll be more questions on the issue to do with COVID, and I assume those will be directed to one of us. So if we'd like to take those questions, who's first? Dr. Chan?
How concerned are you and New South Wales feel that someone with the more infectious variant of the UK strain, as commonly known, in the community for 5 days without knowing they had the virus and without needing to get tested because they had no symptoms? How concerned are you that someone was in the community for 5 days coming into contact with someone?
Well, as I said, we've taken a very precautionary approach to identifying the infectious period, and the community would expect us to do so. We have reviewed those exposure venues, put them out. It's pleasing to see that only one is a close contact venue. I think he did travel on public transport, but again, that's probably an explanation for our mandatory mask wearing on public transport, because contact tracing on the transport system is a little bit more challenging, notwithstanding the great work and support we get from Transport New South Wales. So this, obviously we are concerned, but I'm also confident that the community will respond and will follow the public health advice, come out and get tested. And for those that we identify as close contacts, and some of the staff in these facilities have been identified as close contacts, they will be isolated and tested for the full 14 days. So I'm confident that we can work with the community, that the community has responded in the past, but obviously we'll update you. This investigation has some uncertainties as to the exact mechanism of the transmission, and obviously I'd be a lot more comfortable if I knew that specifically. So we are keeping our options open and exploring a range of other possibilities.
Roughly how many
people are in isolation with Pancakes on the Rocks and the other places?
So I understood that there were probably around 40 individuals at Pancakes at the Rocks, but that obviously sometimes people don't check out and check in, so our contact tracers do interview them and just check if there's been a mistake in their entry time. We do try and minimise the number of people that we unnecessarily put into close quarantine, so I do urge the community to follow our public health advice. We will be following them up as routine and also facilitating their testing. I've indicated the numbers. There were a number of workers that have been put into requested to quarantine for the 14 days. We will continue to update that as the investigation unfolds.
What was the gentleman doing in the quarantine hotel? What's his role?
He's a security guard.
So was he sitting on the floor of the lift?
So we know that the gentleman was undertaking security guard functions, which largely you can imagine in a night shift isn't a particularly busy activity. We know that the persons who was infectious did not open his door and did not in any way depart his room for the full shift from 7 p.m. to 7 a.m. And can I thank the team for reviewing extensively the CCTV footage. We are now looking at extensively the CCTV footage to just check with these infectious case coming in, where else that person could have had any contact. We're obviously treating everyone on the floor till we better understand the transmission mechanism. For that precaution, we're holding on to those return travellers for additional time, a further 14 days since that infectious case departed the hotel. We will be reviewing the testing results on the workers at the hotel, and all of that will give us a really good understanding. But as you know, these are investigations evolve, and we will be the first to update you on any changes that change our thinking.
Do you think it could be an aerosol?
Was he involved in the transfer of this person who tested positive to the hospital?
No, he was not. So
there's a missing link at the moment between that person in the room and the security guard.
That's correct. So at the moment there is not a clear and obvious breach that explains it. Now obviously we're continuing to work through that, review further footage, interview people. So those forensic investigations continue, and But at this point, because of that element of uncertainty, we're taking those other actions which are extending the quarantine period for the people on that level 11.
How many people does that affect, Dr. Chan, staying on the floor? Until it comes close, the security guard was in his duties to the door of the infected patient. Like, was he stationed just outside the patient's door, or was he down the corridor?
He did not come in within 1.5 metres of the door, so he wasn't sitting out just outside the door. But what we're going to be doing is interviewing, obviously conducting interviews of a lot more of the workers all around it, just to further build up the picture. And also we're obviously targeting from the CCTV footage areas, prioritising people that we might want to absolutely test. And as I said, we'll be retesting everyone on the floor. That will again build up our picture. To some extent, we often pursue lines of inquiry hoping that it excludes that path. So some of this activity is to exclude other possible scenarios.
With vaccination, Doctor, and I realise he was vaccinated on the first dose, are you now confident that all hotel quarantine workers had the first dose, and doctors and nurses who come into contact with COVID patients, are they now vaccinated?
So what we know about the quarantine, and it's been an excellent effort, we've offered the vaccine to everyone we had on our books, and we've managed to get 92% of them coming for their first dose. Now, it may be that some of those people are on leave, some of them may be no longer employed in the quarantine system. We have sent out reminders to those individuals and obviously are urging everyone in the quarantine program to be vaccinated. We're now commencing the phase 2 doses, as the Premier and Minister indicated, and certainly we know with the Pfizer having the 2 doses, that period of 0 to 3 weeks apart is important to giving that level of immunity that we would like. Now, as I've said, again, we can't be absolutely certain that people can't be infected with when they're in the vaccine, but what we would suspect is that they may be less likely to pass it on because their viral load might be lower. This is all science that we have to learn. We did actually test this individual's blood yesterday and find that there were some evidence of some response to the vaccination. So I think, again, the fact that this gentleman had come forward to the vaccine to get vaccinated, had been vaccinated on the 2nd of March, shows that the prioritisation of our quarantine workers is been a key component of a solid response.
The doctors and nurses, those in the health system who you know come into contact with COVID?
So they've been prioritised. So we've had to, have to recognise that the vaccine availability has been limited. So we've chosen to prioritise the vaccine rollout to those most likely to come into contact with COVID, and that is our workers in our quarantine facilities and our healthcare workers in certain settings, particularly in emergency departments and critical care settings, and those that are taking the COVID tests and in pathology. We've now, with the adjunct of AstraZeneca and moving through that first high-risk group, we're now expanding it to a much broader group of healthcare workers.
Coming to work today thinking there would be more cases, is this a better result, considering that there was so
I knew there were no cases because no one rang me about a case in the middle of the night, so I was pleasantly happy not to wake up. But look, I think that every day we are building more of the picture. I just want to acknowledge the work of the teams across health that have pulled seamlessly together the pathology, the fact that we had genome sequencing done by 5:30 last night is actually amazing compared to, I usually said to you, 24 to 48 hours previously. So I think the team have worked really effectively. We're putting ourselves the best position to really understand this as quickly as possible. But there may be additional cases, and obviously I've explained that cases, if they occur within the household, that household is now in quarantine and poses no ongoing risk. So we may see some cases, but if they are amongst those that are quarantined, then it doesn't pose a risk of that broader community transmission.
Is there an intermediary? Before, Dr. Chan, you said that not necessarily, if you had the vaccines, you don't still know whether they would necessarily still be able to be infected. Does this raise the issue of someone who has had the vaccine becoming a
potential secret carrier of the vaccine. They would show no symptoms or anything, so they wouldn't get themselves tested. They wouldn't ever be able to know if they were potentially a problem in the community. They could be walking around vaccinated but spreading.
I think in this case we know that the people that are most likely to come into contact with the COVID are our quarantine workers, and so regardless of their vaccination status, we'll be still undertaking the surveillance swabbing on them and those usual things, and still have the recommendation.
In that case, a doctor
Yeah.
treating someone like the Brisbane case right now would be wandering around completely vaccinated perhaps and not knowing that he's in close contact with hundreds.
Our guidance would be still, regardless of your vaccination status at this point, we would still recommend if you've got COVID symptoms to get a test. And so obviously
Would
that,
have symptoms if he had the vaccination. That's the point I'm making.
well, we know that that again, we would then pick it up in the next, if there were further transmissions, if that person, for instance, is in the case of Princess Alexandra, and I hate to talk on behalf of another state, but if I do an analogy for our Sydney Health accommodation, where we actually have positive COVID patients, we actually do have surveillance swabbing of the staff in the Sydney Health accommodation. So that would be my response there. But look, this is, as we go through 2021, we're going to have to adjust our response to vaccination. We're in the early phases now, so it really doesn't mean a lot for our guidance. If you get COVID symptoms, come forward and get tested. But as we learn more about the vaccine, its behaviour, and once we've vaccinated, particularly the most vulnerable to the severe consequences, we will have to recalibrate our public health response to COVID, because we will be living with COVID for many years to come.
Dr. Chan, would it be useful from a health perspective to have surveillance saliva testing done on hotel quarantine workers, even when they're not on shifts? You could have picked this up potentially on the Monday or the Tuesday rather than picking it up when this individual returned to work on Saturday. Would that be a useful health response?
So the surveillance swab testing is a technical test that is done. It's a non-validated test that's not routinely available through any pathology service. So it's not like you can go down to your local pathology provider and get access to this. And so it really does have to be transported and dealt with in particular ways. So it's very useful in this workplace setting, how it's been rolled out, so that the staff get swabbed either at the beginning or the end of the shift. But it is not readily available when you're not in that workplace setting, because of the way in which it has to be transported and handled to get to be reliably tested. So as we put in a range of risk mitigation strategies, and it really is around how they work within the operational parameters of the program. And we have had the vast number of returning overseas travellers have come into through the New South Wales quarantine system. So we'll continue to, as I said, learn lessons and embrace those changes. I don't know.
Can I ask you a question?
Certainly.
The Victorian Health Department is weighing up apparently whether to redesignate parts of New South Wales as an orange or red zone as a result of this quarantine breach. Do you think that is a fair response, or would you be disappointed if that?
Oh, I think at this stage it would be an overreaction. We've only had the one community transmission case, and it's been confined to the guard. No doubt it's always a concern. When a case, when the virus gets out of overseas travellers, it's always an issue for us, and it always causes us sleepless nights and worry. But that's the nature of a pandemic, and as the vaccine rollout continues, we do need to change the way we look at these examples. And I would urge all state governments to give us a chance to demonstrate our capacity to get on top of this, to demonstrate our capacity that our vaccine rollout is really complementing the excellent work of our contact tracers. And I didn't have the chance, and I should have in my introductory remarks, really pay tribute to Susan Pearce and all those in the health department who have exceeded our target in getting the vaccine out to those that need it. For the first 3 weeks, around 10,000 of those who were vaccinated were, over 90% of those in and around the quarantine system. The balance were key health workers in those high risk jobs. So the strategy for us in making sure we vaccinate those in and around the quarantine system and the highest risk has been absolutely critical and justified. And I say to all states, if we're going to give our citizens the opportunity to have a normal existence during COVID, we need to make sure that we change the way we think about it. And that's why I urge everybody to be patient in other states, not to take those drastic measures, because it just dashes confidence everywhere when people can't rely on borders staying open. And I think New South Wales has demonstrated time and time again our ability to contain, to get on top of things, but also to keep our jobs and our economy open. And that's really critical. I'm not suggesting there's no risk, there always is. But we're in the middle of a pandemic, and all I'm saying to other states is please assess the risk against the facts. And at the moment, there is one case of a guard. We've been able to isolate those that are at high risk of perhaps having acquired the virus. And of course, coming days are always critical. But I just say to everybody, let's not overreact. Let's base our decisions on the facts, and let's give our citizens the chance of having a normal existence. Because whilst there's the fear of borders opening and closing at a whim, it just dashes confidence, and that's the opposite of what we need. Yeah.
Friday, the Prime Minister said that he was hopeful that there would be the first round of vaccinations done by October. Yesterday, he adjusted that and said he thought both rounds could be done again by October. What's your understanding of when the country will be?
Well, look, New South Wales is always looking at opportunities where we can actually bring things forward. So it really depends on the supply that our local AstraZeneca CSL plant is able to provide. What I can say confidently is that New South Wales has demonstrated our ability to get the doses out as soon as possible to whoever needs it. And that's certainly our position. We are having discussions now within ourselves and also with the Commonwealth as to how we can complement the GP network, the pharmacies, and all the other locations where the AstraZeneca was going to be offered to the wider community. So as you know, New South Wales health responsibility stopped after the critical stages of the vaccine being rolled out to health workers. We are now having discussions amongst ourselves as what we think is a healthy number to keep going with that, to offer to the broader community. And we're having those conversations with the federal government. What that means is that if there are any unintended delays, well then we'll catch that up, because we'll have our own systems in place as well as what the federal government rollout is. And I think that's perhaps the best strategy at this stage, and I'll be getting briefings later this week on what we think our capacity is, and that will inform our ability to offer a certain number of rollout vaccines to the Commonwealth. I'll get to everybody, don't worry. Yep.
Do your plans for restrictions for Wednesday change because of this case?
Not at this stage. It hasn't changed our risk assessment at this stage at all. But obviously, I think the public appreciates that during a pandemic we have to be flexible, we have to adjust our settings according to the risk, and at this stage there's no reason for us to change anything. However, it's an evolving situation, and Dr. Chunt will be, and the Minister and myself will be the first to say that it's always an evolving situation. If that risk profile changes, of course we'll assess that. But at this stage, there's nothing for us to reconsider. But it's an ongoing situation, and we're just so grateful that everybody who's been asked to come forward and get tested, or who's been asked to isolate or follow the health advice, has done that. And can I also say, this also demonstrates how effective our QR code system has been in New South Wales. The QR code have been unbelievable in monitoring workers, monitoring people going to particular venues. It's just provided that extra bit of ammunition or extra bit of defence for our health contact tracers. And I just want to thank everybody in the community for being so respectful and cooperative of the advice we're providing.
Premier, does it concern you that even though you put in tighter protocols earlier this year for hotel quarantine workers surrounding testing, that there still was a leak? Should more be done?
Look, it's always a concern, but not surprising whatsoever. The fact that we went for 55 days straight without a case is almost miraculous during a pandemic. So, I used to touch wood every day. We had 0 community cases. I think the challenge for us is how we respond to it, because we know that no matter how perfect we think a system is, human error or anything that can occur may occur. It is a human system. Thousands of people contribute towards it, and can I say, full thanks and gratitude to every single man and woman who puts themselves forward to work in our quarantine system, whether it's a health professional, a cleaner, hotel worker, security guard. These are people who've got the guts to work directly with people who have the virus, and if it wasn't for them, all of us wouldn't be in the position we are today. So I just want to thank the thousands and thousands of workers who put themselves forward. What they do is very high risk, and whilst we always worry when the virus escapes, it's not surprising at all, and I'm just deeply grateful that the response to date has been rapid and it's been comprehensive, and we hope that continues.
Premier, just on the Women's March, why did you decide not to march, and do you support the cause?
Well, I think for every woman that marches, there are thousands of others who support the cause but who, because of work or family commitments, can't get to the march, and I'd put myself in that category.
Jodie, I thought your government corrupt, and she's got delivering the lowest economy in history. Are you unbeatable?
No, and I also, I think what I've learned in my role is you have to focus on the job you have to do and not worry too much about what others say.
Dr. Terry Chant said that 92%
Yeah.
of the hotel quarantine workers have got the jab now in front of them, which makes up with the remaining 80%. Given your comments earlier about how people in the quarantine system should get vaccinated or face not getting any shifts, the 8% of people who you think work in the quarantine system who haven't got the jab yet not be given more shifts?
Yeah, well, look, as we said, we suspect that 8% are people who are on leave, or they may not even be working in the system anymore, or we may not have needed them because of the pause that we'd had a month previously. So there could be a number of factors, but the important thing is that 100% of the vaccine 100% of workers have been offered the vaccine. To date, 92% have been vaccinated, but that number could even be higher on the proportion that are actually working. As I said, we want everybody who works in quarantine to be vaccinated, and that's a choice people have.
But what happens to the people who are offered the vaccine that work in?
Well, as I understand, I haven't had any cases of people objecting to taking the vaccine. I don't have any of that brought to my attention whatsoever. In fact, the response that I've had from all of our workers, as I've had the pleasure and honour of visiting the 3 hubs in Sydney, is the enthusiasm with which people are accepting the vaccine. And I have to say, as one of the fortunate 35,000 or 37,000 who got the jab in the first 3 weeks, it makes me feel that little bit safer, although I haven't had my second jab yet. And I'm hoping that many people in the community will have that same sense in the coming months.
Is it still too risky though for a hotel security guard to have another job such as this person will do?
Well, it's not, because we can't stop, and I would never want to stop a security guard from attending their child's school or attending an event. I mean, people have lives outside of their jobs, and you can't cocoon people who are already doing that job. What you can do though is put every precaution in place to make it as safe as possible. We have to remember that behind every single person who works in and around the quarantine system is someone who has a life, who has family, who has commitments, whether it's paid or unpaid. But what we do require is the strictest safety requirements for those workers, and again, we thank them for putting their hand up to do this job. It's a risky job. How many of us standing around here would put our hands up to do that? And I just want to say how grateful we are, because the great work they've done has kept all of us safe. It means that we're getting the vital freight because planes are landing, and also that Australians are getting reunited with their loved ones, many of whom have undergone very difficult things overseas when Aussies are trying to get back home.
What about salivary testing, Premier, on daily? Salivary testing when people are not on shift, that would be an extra precaution. You've made comments that workers in the quarantine system should get vaccinated or not have a job, so should they get a salivary
Look,
test?
we take the best health advice. I always forget Kerry the body that does that. Who are the what's that called?
The Australian Health Protection
Yeah.
Committee, but
No, the other name, the immunisation people.
Targi.
Yeah, Target, yeah. So we always get advice from the expert immunologists on what is the best thing to do in those circumstances. And if they change their advice and want us to go even tighter, we will. But let's not forget, the risk is always there. It doesn't matter how secure your processes are. Unfortunately, when you have a human system, unintentional issues can arise, and we have to be conscious of that. The risk never changes, it's always there. It's how you manage that risk when something does happen, as occurred over the weekend. Thanks.
Can I ask about the topping out ceremony?
The opposition
No.
is likened Jared Hayes, HSU, was likened Tripodi and OB.
I'm sorry, what?
Yeah. Jodie has likened him as an Obeid or a Tripodi. You've worked with him closely. What's your experiences with Jared?
First of all, I haven't heard those comments. I just say this, that obviously Jared Hayes leads the 5th biggest union in the country, and he puts his members' interests first, and thus far I've found him completely trustworthy. So we're going to do the topping out ceremony now, guys. This is good. I might just come over here with Uncle Lloyd.